meeting of our Leveraging Hope teams, and we are just thrilled at the way the work is going and all of your work that you're sharing with one another. Let me just get out of this announcement about recording here. Okay, now we're back. Good. We're just thrilled with all the work that you're doing on the ground in your communities, and hopefully you're finding ways to use data, our data and other sources, to help drive a new narrative and increase the urgency and importance of your work. So we're going to ask you just to check in your name, and if you could put in the chat any takeaway from your peers that you've had an opportunity to hear so many presentations. They're all equally impressive and exciting. So if you could just come off mic and just say your name, and then put in the chat a key takeaway from your experiences with this group to date. So that's my job, and I'm going to invite you to do that, and then we'll turn it over to Luz. So who's going to introduce themselves first?
Hey there, I've been absent, so I'll go first. It's so good to be back and to see everyone. Angela Waters Austin with the One Love Global team.
Great. Hi, Angela. Can you put in the chat any key takeaways from the presentation so far?
Hi, everyone. I'll go next. My name is Drew Glover. I am the Development Officer and Senior Community Organizer at the Selma Center for Nonviolence in Selma, Alabama.
Hey, Drew. And you can pass it to someone to keep it moving. Thanks, Drew.
Absolutely. Let's pass it off to Karen.
Good afternoon, everyone. I'm Karen Siegel. I'm at Health Equity Solutions here in Connecticut. Nice to see you all again. And I see, let's see, Carla.
Good afternoon. I'm Carla Galad. I'm the Deputy Director and co-founder of the National Collaborative for Health Equity. It's good to be with you all today.
Hi, I'm John Davis, Secretary for Louisiana Center for Health Equity, and it's a pleasure to be back.
Hi, Derek Chapman, Interim Director of VCU Center on Society and Health. Over to Emily.
Good afternoon. I'm Joyce Peoples. I am the Violence Intervention Director here at the Selma Center for Nonviolence, Truth and Reconciliation. It is just a blessing to be here with you all today.
Hey everybody, my name is Emily Zimmerman. Glad to see you all again with the VCU Center on Society and Health.
Hey everybody, I'm Sarah Gettle, pronouns she, her, and I'm also with One Love Global. Good to see everybody.
Hi all, I'm Diane.
Go ahead, Diane.
Okay, I thought I heard someone else. I'm Diane Bishop. I'm with the Center for Society and Health. So good to see everyone.
Welcome.
Welcome.
Hi, everybody. My name is Ainka Jackson. I'm the Executive Director of the Selma Center for Nonviolence, Truth and Reconciliation. I'm so happy to be with you all today.
Hi, Ainka. Good to see you. Yeah.
Hello, everyone. My name is Mordecai, and I'm a part of the One Love Global team here, the One Love Global Center for Healing, and I'm glad to be here.
Hi, everyone. My name is Kevin Collins. I use he, him pronouns, and I am with Health Equity Solutions along with Karen.
Did we get everyone already?
I'll go. Michael Scott, hey everybody, Equity Matters in Baltimore and Central Maryland. How y'all doing today?
Hi, Michael.
Hi.
Good morning, everybody. Claudia Leon in Ohlone, San Francisco territory with the Latinx Racial Equity Project, and happy to see you all again this morning.
Welcome.
This is Linda Murray with Shea Cook County out of Chicago.
Hi, Linda.
Good afternoon, everyone. This is Aisha Clark. I am the Deputy Director with Health Equity Solutions here in Hartford, Connecticut.
Welcome. Anyone else?
Good afternoon, everyone. This is Sandra Chappelle from the Center for Achieving Equity in Greater Cleveland, Ohio.
Sandra.
We're missing our Mississippi people, huh? Anyone else?
Hi, apologies. I joined a few minutes late here. My name is Patricia Fraun. I'm with the Chicago Area Fair Housing Alliance and also a member of the Cook County Collaborative for Health Equity.
Welcome.
Welcome. Yeah. All right. Is that every?
Yeah, we want to read some takeaways. Bethlehem, why don't you read the takeaways?
Or
take a break to cough.
So Angela's takeaway, she mentioned the work is defined and driven by local context, culture, and capacity. No singular path or approach. It is all necessary, especially love youth-centered approaches. Drew mentioned that data is important and will help to move the work. The work is hard and we need to balance it with self-care, as we were talking about. We're a group of passionate, dedicated people who understand the issues and have the skills and tools to make change. John Davis said, I love the dedication of the people involved in trying to solve the problems in their communities. Karen mentioned, many of us are finding ways to use data to show how the powerful personal stories are reflected in the larger population. And then Ainka mentioned data helps with accountability and encouragement towards the goals. And Claudia just put in the chat, key takeaways, how similar and different the struggles and issues related to equity and poverty and healthcare are across the country, and how data can rally, show the impact when we dig deeper to show impacts for different ethnic and race groups. It can be really powerful.
All right, thank you, Bethlehem. So if you can pull up the slide, Bethlehem, that we usually use for the presentations, just as a friendly refresher.
Sure. Do you want me to go through the agenda quickly?
Yes.
Okay.
Thank you.
Yeah, of course. So we've done our welcomes already. We'll quickly go over the team expectations. Then the Health Equity Solutions team from Hartford, Connecticut will present first. We'll have 20 minutes for presentation and 5 minutes for Q&A. Then the Selma Center for Nonviolence, Truth and Reconciliation team will present. We'll have an overall group discussion, so no breakout groups for this meeting, and then we'll have closing with updates.
All right, do you want to also talk about the technology, the prompts?
The presentations, I have that slide up.
Oh, okay. No, I was talking about the technology reminders, but we'll go through the slides. So as usual, we're going to hone into your local focus area policy work during your presentations today. Figure out which data sources helped your organization to create the most compelling narrative to increase health equity, identify the goal for progress and your rationale, and also quantify the distance to goal as much as you can at this point. We know that's a work in progress for many of you during your presentation. So if we stay focused on that, that is the purpose of the presentations today. And I will now have the pleasure of introducing you to Karen Siegel, the Director of Policy at Health Equity Solutions in Hartford, Connecticut. And can you remind everyone about the signals, please?
Yeah, sure. So Karen, I'll give you a 1 minute heads up at 19 minutes, a verbal warning. And then at 20 minutes, I'll let you know that the time is up.
Thank you. And I am not planning to speak for a full 20 minutes, so I think we will be fine. I wanted to leave plenty of time for questions. It's
Great idea. Thank you, Karen.
Absolutely. It's really nice to see all of you, many of you again. As mentioned, I'm the Director of Policy here at Health Equity Solutions, and I use she, her pronouns. I'm excited to share a little bit about our work and have really enjoyed learning about yours. So I am planning to start by just telling you a little bit about Health Equity Solutions, the context that we're working in, the project that we're working on with leveraging HOPE data, and then I'll share the data that we've been using so far. So Health Equity Solutions is a statewide nonprofit. We're focused on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in Connecticut. We engage in education, outreach, and advocacy to achieve those goals, and we take a very race-forward and intersectional approach to equity. So we acknowledge the specific ways in which racism is woven into our status quo and that racial and ethnic disparities persist within other demographic groups experiencing oppression, while also acknowledging the ways in which multiple identities, and particularly sexual orientation, gender identity, and disability status impact health. And this is our theory of change. It's to educate so that people have the information they need about health equity, the impact of racism on health, and specific policies, and to agitate through training, organizing, and capacity building, preparing for action, and motivating folks to get involved. And finally, advocate by working to support change and develop policies at the government and institutional levels. And while we work at all levels and with individual institutions, most of our work to date has been at the state level. So we do have local campaigns. We've done a tiny bit of federal work, mostly state level work. And this is just us to give you a sense of who we are. The staff is at the top, our board is at the bottom. And the HES team includes folks who are focused on training and outreach. That work is led by my colleague Kevin, who's also on the call, administrative and legislative advocacy, and policy analysis. So just to give you a little bit of the context that we're working in, I thought this graphic from Leveraging Hope really captured Connecticut in a nutshell. Overall, the state looks like it's doing great. We have really high overall rates of insurance coverage, positive health outcomes. But as soon as you start looking at the data disaggregated by race, things look very different. We have really high rates of racial inequity in every ranking system that I've ever seen, and on most individual indicators of health and social well-being too. So what contributes to that? Well, one major factor is that the state is extremely segregated. Half of Connecticut's people of color live on just 2% of the land, and that land is also the 2% of our land that has the least access to social and economic opportunities. And Connecticut also differs from many other states in that we have no county governments and a very strong system of very local control. And what I mean by that is that we're a tiny state. You can drive across the state in an hour and a half, maybe 2 with traffic. And we have 169 municipalities, some of which also have smaller local governments called boroughs. And we have over 180 school districts. And so that system of insular local governance has helped to institute and maintain the results of redlining and uneven funding of public systems such as schools and public health and anything else you can think of. And so kind of moving on to what HES is up to and how it intersects with this project. In 2021, an omnibus bill on health equity passed our state legislature. This bill is now Public Act 2135. It had 21 sections with a number of equity-focused provisions. And I won't bore you with all of those, but just a few that are really relevant to this context. First, it declared racism a public health crisis. It standardized the way the state collects health-related race, ethnicity, and language data, which I just thought would be of interest to this group, given the interest in data. And then after the acknowledgement of racism as a public health crisis, it also created a commission on racial equity in public health. And so the commission was created with the charge of creating and implementing a strategic plan for health equity in the state, and with engaging community members in its work and ensuring that that strategic plan is community informed. So connecting the dots, what does this have to do with leveraging hope? So HES was named as a co-chair of the commission, and we noted that community engagement was really vital to the success of this effort and also not fully funded or kind of well established by the statute. And we had a history of outreach related to our own work. Since its inception, HES has conducted annual listening sessions to inform our policy agenda. And we decided to adapt that process to also inform the work of the commission. And this complements the Leveraging Hope work because one of the many things that we hear when we do listening sessions and in conversation with our local partners and in feedback from trainings is that local data disaggregated by race and ethnicity is both really important and really rare. And it's important because the average often hides the experiences of Black, Latino, Latina, Indigenous, and Asian residents of the state. So we set some goals for our summer outreach work this year and adapted our usual listening session format. We're now calling them community conversations to make it hopefully seem a little bit less passive. To more specifically serve the commission by asking people how they want to be engaged in advocacy in general and specifically with the commission. In 2020, we also started developing a cross-sector advocacy agenda that we've adapted over the past couple of years to include more partner voices and more ideas from the community members that we interact with. And this was initially created as a broad framework for how to get to health equity to kind of make the resolutions and acknowledgements of racism as a public health crisis lead to more concrete action. And this year, we've evolved it into a candidate education guide that outlines specific policy changes and are working with partners to both better inform that work and also disseminate it and use it as a point of discussion during the election season. And we held 3 workshops earlier this year to gain input on this, and it should be published in the coming weeks and can inform the commission's work as well. And finally, we're aiming for all of these efforts to just increase grassroots health advocacy or health equity advocacy at the state and local levels, and to leverage the forums that we're holding to identify areas of interest and create campaign materials that people can adapt and run with to promote the policies that they most want to see in place. So this is a flyer for the open virtual community conversations we're holding starting this week. We'll also do a series of in-person and hybrid sessions with community-based partner organizations, and we'll be using the Leveraging Hope data as a way to level set. So we always start our listening sessions and community conversations by ensuring that everyone has a shared definition of equity and is grounded in some of the facts related to health equity in the state and in the ways that the consequences of systemic racism impact health. Derek and his team got me some terrific local data last night and are trying to, still working towards that distance to goal, but I think we're getting close. So we chose a few indicators this year to start with. So we started with livable income to create a shared understanding about the immense racial inequities in Connecticut, and particularly the large racial and ethnic wealth inequities. So while Connecticut ranks overall in many indicators, we're 40th in livable income, and less than half of the Hispanic residents of the state live in a household with livable income, which is, I thought, was a pretty eye-opening statistic. And then we included premature mortality to demonstrate the combined impact of the experience of racism and its social and economic consequences on health. The rate of premature death for Black residents is nearly twice the Leveraging Hope goal, which also is, again, pretty eye-opening given that Connecticut ranks first on this area of measures. And finally, because there has been a lot of public debate about zoning and bringing affordable housing to suburbs, we wanted to highlight poverty concentration and the disproportionate number of Black, Latino, Latina, and Indigenous people living in communities affected by disinvestment, and the related need to bring resources to these communities while also creating housing choice for low-income individuals. So we really see the housing debate as a both-and proposition. And because the debate has so loudly been exclusively about zoning, we wanted to kind of offer this as a way to say, there's multiple ways of looking at this. And then lastly, we were asked to consider what we would really like to have in an ideal world in terms of data. And this is kind of what we came up with, which is, again, more municipal level data disaggregated by race and ethnicity, because, that's how our elected officials think, is by municipality, and we don't really have a county government. So, that's difficult because sample sizes can be very small, but multi-year data sets have been useful in the past, and getting to a point where we can disaggregate, and I think that would be helpful to support local advocacy. We do have partners working with hospitals, health centers, and town governments who all find that municipal level data really helpful. Then just improved race, ethnicity, and language data related to health outcomes, which I think is coming. I think it's really an exciting step that the state took to standardize the way that data is collected. And I do think that ultimately it will improve the quality of the data, because it's now being collected at a more granular level. And so there's a higher chance people will see their identity represented in the choices that are available to them. So that is exciting to know that it's a want that is likely to be fulfilled pretty soon. And then finally, just increased transparency, and particularly publication of interactive and de-identified data sets so that advocates can use them. I think resources like Leveraging Hope are incredible. We don't have a ton of data coming directly from our state in a really sort of transparent data democracy, democratic way. And so that's something we will continue to advocate for. So that's all I had. I'm really excited to hear what you all think and how it relates to your work, and happy to answer any questions. And I can take this down so that we can all see each other.
Thank you, Karen. That was amazing. I'm struck by how redlining is enabled by the system. So now I would like to open it up for Q&A. But first, I think I forgot to thank our illustrious leader, Dr. Gail Christopher, on a very special day. Today is her birthday, so you may put all your greetings in the chat. And thank you, Gail, for your great welcome, as always. Now, I'd like to open it up for Q&A from the team. I thought this was very inspiring to see the work that has followed the declaration as, racism and health crisis. So I open it now for any questions. Make sure you unmute yourself. Reactions, questions for Karen?
I could start with a general reaction. I'm trying to think of a good question because there was so much great data in the breakdown, connecting some various indicators together and not just focusing on one or two, but figuring out a really holistic presentation around the data. So I really appreciate that, Karen. You had mentioned the elected officials and how they think with regards to data. What are some things that you've done in the past with data to make them be more receptive, and how do you think you might use this data, specific, or additional data to make them more receptive or understanding of the issues and the solutions that you're proposing?
Yeah, that's a great question. I mean, it's been hard to access municipal level data, but what we do have, we try to send to every legislator by the towns that are in their district. So some legislators represent 15 towns and some represent half of one. So we have in the past done that through a coalition that we work with, particularly around how many Medicaid enrollees live there. But what we haven't been able to do is share with them more about the sort of general circumstances that their constituents live in. And I think that's where this will be really powerful. And one of our partner organizations did a great report kind of breaking out everything they could find from census data into municipal level. And our partners who are doing the organizing work and doing the more grassroots work have found that to be very useful. So that's my hope, is just to kind of use this to complement, the story collection and the narratives that we tell to show why these solutions that folks come up with are important. And I know that's all a little bit broad at this point, but I think we're just at the beginning of this project and we really want it to be community led. So we don't have the more granular goals just yet. We will.
Thank you.
Thank you, Karen. Any other questions, reactions?
Yes, I have a question, actually. Thank you. First, I love the presentation. I was sitting here looking at all that you've done, and my question is, what's your staff look like? How many people do you have full-time that are helping you put all of this together? Because that's one of the issues that has to also be addressed in all organizations.
Yeah, well, so I joined ETS about 2 years ago. I was doing very similar work for another organization in Connecticut. And at that time, there were 5 of us in total. Now, I've lost count. Aisha may know off the top of her head, but I think we've almost tripled in size. So we're about 15 now, I think, once we fill our open positions. So the policy team is—
So it's no longer an initiative, it is a full-time job.
Right. This is a full-time work so we have a team of 4 on our policy team, and this is one piece of what they do. We also have a consulting work that we do. So about half of our policy team is focused on administrative advocacy, policy research and consulting. And the other half is focused on legislative advocacy, outreach, and this kind of campaign. So that's 2 people plus me.
Okay, thank you.
Oh, Aisha is correcting me. So right now we have 11 staff members. We have 3 or 4 open positions right now. And a couple of wonderful volunteer interns who are hugely helpful.
Great.
This is Gail. Did the legislation that created the commission, did it also fund your work? And does the legislation actually provide resources to support the efforts?
Yeah, I can see Aisha laughing. We've done so much work to try to fundraise over the last year. So we worked really hard on that, on informing that legislation. That was a main advocacy project for us. We were not told that we would be named in the legislation, and it did not fund us to do the work. It did fund the commission. So the commission is funded to hire an executive director, which they just did after a false start. So it took about a year, but they have an ED on board, and she has funding to hire 2 staff. But it didn't fund anyone to do the community engagement work. And it was really important to us that start as soon as possible, that people not feel like this was a whole bunch of words and value statements without action behind it, and that no one was listening. So we started trying to do some fundraising around both our staff's time, helping to co-chair the commission, and the outreach and engagement work that we're doing to inform the commission.
Thank you. Very interesting. Any other reactions or questions for Karen? Okay, I think we can thank Karen and all of you who have participated in the Q&A. And now we will move to hear a presentation from Drew Glover, who is the Senior Organizer and Development Officer at the Selma Center for Nonviolence, Truth and Reconciliation at the Healing Waters Retreat Center in Selma, Alabama.
Thank you.
Drew, it's all yours.
Thank you so much. It'll be a joint presentation with Miss Joyce Peoples, who will actually start us off. She's the director of the Violence Intervention Program, but I'll let her introduce herself. I'll start the slides, and thank you for welcoming us to the program.
Thank you, Drew.
Joyce, it looks like you're muted.
It's great to be with you all today. Of course, today we will have a great opportunity to look at the HOPE initiative in collaboration with the Violence Intervention Program here at the Selma Center for Nonviolence, Truth, and Reconciliation. I am Joyce Peoples. I serve as the Director of the Violence Intervention Program. I'm so proud to introduce my team here. We have some wonderful people that lives right here in the community that are dedicated to making this dream of a beloved community come to life. Our mission here at the center is to partner with institutions to promote love and establishment of justice and to build the beloved community. The center is committed to transforming and healing the root causes of physical, political, psychological, environmental, economic, and racial violence at personal, family, community, and systemic levels. Selma 2.0, Bridging Divides and Building Beloved Communities. Founded in 2015 amidst the increased violence here in Selma, Alabama, Dr. Bernard Lafayette, co-founder and board chair, said that we needed a Selma 2.0. And since we're tracking the metrics of low homicide rates, what does it mean? What does it mean to be safe? And how do we make that happen? We need to make it happen by utilizing and making the beloved community come to life. An overall effort to achieve a reconciled world, raising the level of relationships among people to a height where justice prevails and persons attain their full human potential. Again, what does it mean to be safe? And how do we reach our full potential if your basic needs aren't met? The Maslow hierarchy of needs, one of my favorite studies, shows us the importance of individual psychological needs being met in order for one to reach their full potential. According to the Department of Justice statistics, when poverty is present, violence shows up in similar rates regardless of race divides. Poor urban Blacks had rates of violence similar to poor urban whites. Notice that poor persons having or living in urban areas had violent victimization rates similar to poor persons living in rural areas. Although there are many forms of violence, such as low income, limited access to education, and segregation, they all lead to negative outcomes. Drug abuse, physical violence, public health crisis, depression, and relationship problems, among others. Again, we need to build the beloved, healthy community. In our healthy, beloved, healthy community, we have 4 components: celebrate, educate, grieve, and sustain. Celebrate, to being able to see positive aspects of community allows people to think the positive possibilities. Educate, passing on local knowledge and history of the community helps to create a sense of identity and grieving. A community must be able to grieve positively support healing and growth and sustain, creating employment opportunities, increases economic prosperity, and a sense of purpose. Now we'll hear from our Executive Director, Ainka Jackson.
My name is Ainka Jackson. I'm the Executive Director of the Selma Center for Nonviolence, Truth, and Reconciliation.
Hello, I'm Joyce Peoples. I am the Director of the Violence Intervention Program.
My name is David Perry. I am the Victim Manager Service Advocate.
Hi, my name is PJ Fox, and I am the project consultant for the Selma Community Violence Reduction Strategy.
We were founded in 2015 amidst the 50th anniversary of the Selma to Montgomery March and Bloody Sunday. That weekend, when President Obama was here and people were here from all over the country and different parts of the world, the KKK allegedly distributed 30,000 recruitment flyers. Then we had 2 murders that Sunday and 2 more in less than a month in a town that's less than 20,000 people.
I want to talk to you about healing our.
I'm gonna jump to this.
About healing our community. We've had a rough run of violence and a lot of killing in our community, and we need healing on both sides. So our focus is on healing both the victim and the perpetrator.
2014, our county was the poorest in the state. 2015, Selma was the most dangerous place to live in Alabama. And in 2016, we were the 8th most dangerous place per capita in the whole country. So this place where nonviolence overcame violence, and on this very bridge, was the 8th most dangerous place per capita in the country.
We want to make sure that we have a healthy community by using circles of healing, circles of restorative justice, circles of reconciliation, and really just circles of love to bring our community to a place of healing.
We're excited and we are geared to moving and saturating our community with the Healthy Beloved Community Framework.
The framework is based on the idea that there are 4 major or essential components to developing and sustaining a healthy community. Those 4 components are education, consoling grieving, sustaining life, and celebration. And by looking at those 4 components on 3 levels, ourselves, our clients, and our community, we are able to accurately address the reasons why those components may not be healthy. And it's important that we are continuously reflecting and evaluating each of these components to ensure the continued health of a community. Doing this, often we are able to really narrow or hone in on specific root causes.
When I was studying and practicing to become a nonviolence trainer, I met PJ Fox, and he introduced me to the street outreach worker model that was rooted in nonviolence, and I knew an answer for Selma had been found. Nonviolence gets to the root cause of an issue, and it helps to deal with the culture of violence that has plagued Selma for far too long.
And that's really important. We want to get to the root causes, and this framework is a real guideline for us doing that.
This strategy is holistic, so we have prioritized our clients by way of workforce development and intensive case management.
We believe that broken relationships have led to broken economies, leading to broken communities, all in need of healing. Not in need of fixing, all in need of healing. So we partner with communities to heal relationships, to heal the economy, and to heal communities.
We have a beautiful city, beautiful community, and we want to make sure that our citizens are healthy and our city is flourishing, to where Selma will no longer be one of the most violent cities, but it would be one of the most vibrant and most attractive cities for people to relocate to come to.
Dr. Bernard Lafayette, our board chair and one of our founders, who is a leader in the Nashville sit-ins, the Freedom Rides, the Selma movement, and who Dr. King appointed to be over the Poor People's Campaign, said, "There's unfinished business of the civil rights movement, and we need a Selma 2. So we say, we're leading the charge for Selma 2.0, finishing the unfinished business of bridging divides and building the beloved community."
I encourage you to look at the materials that are posted along with these videos and to contact us about further information. And we welcome discussions and feedback. Thank you.
We expect our work to have the following outcomes. Expected outcome 1, reducing street level violence through an effective evidence-based outreach framework to engage with individuals most likely to shoot or be shot. Expected outcome 2, reducing acts of retaliation and increasing positive healing through innovative services and nonviolence conflict resolution, skill building and training. And expectation 3, increasing educational and economic opportunities for individuals, neighborhoods, while offering and next we'll hear from Drew Glover.
Plagued by the autoplay of YouTube. You can go ahead and finish the outcome. Sorry about that.
Oh, that's okay. And I was saying increasing our third expectation, increasing educational and economic opportunities for individuals and neighborhoods while offering deferral options and an alternative to policing and mass incarceration. And next we'll hear from Drew Glover.
Thank you, Joyce, and hello, everyone. Sorry about those technical issues, both from the lag of the video and then the autoplay from YouTube, but hey, what are you gonna do? So this is a great opportunity to talk about the data that's associated with the Leveraging Hope and the Hope Initiative in general. It was wonderful to get a chance to dive into both what's available on the website, and it gets to chance to work with the folks from Derek's team and the other data team as well, to be able to kind of get a look at what's going on in Alabama, and then as we kind of hone in on Dallas County where Selma is located. So right here, just looking at the national comparison, this was something that was striking right away when looking at the data, was that based on Alabama, which is up there that's highlighted, it is one of the areas that has the lowest percentage of safety for Black individuals to live in. Arkansas, Louisiana, and Nevada were the ones that the only ones within the country, it looks like, that have a lower population of Black identified people living in low homicide counties or areas with low homicide. The other thing that was really noticeable, though, was in all of Alabama, no matter the racial group, it looks like no more than about 51% of people live in a place that would be noted as low homicide. So just those numbers in itself talk a lot about the violence that's going on in the state. But then as we dig in a little deeper and start to look at how it compares to the other states in the country, definitely higher in levels of racial inequity when we're looking at that. But then as we get into the distance from goal, like I said, it's almost the furthest with regards to how far we need to be able to get to the hope goal, which is of course 100% of people living in low homicide areas. Another comparison, just looking here as far as the numbers, ranking 34th in community and safety factors, which is the overarching category where low homicides exists. So a lot of work to do, but also in looking at the health outcomes, 49th out of 50th, which talks a lot or says a lot about what's going on within the state itself. Looking a little bit closer at the state as a whole, like I mentioned before, about 40% of people live in counties on average with low murder rates, which is appalling compared to the hope goal of 100,000. So that's about 3 million more people that we need to work on getting into low homicide communities to be able to reach that hope goal. Other notable points that really stuck out in the data, of the various racial demographics and groups, the impact on American Indians and Alaskan Natives with inequity with access to primary and psychiatric care, but also the Black folks in the state with the highest rates of premature mortality, infant mortality, and low birth rates, as well as the likelihood to live in areas with food insecurity, and higher crime rates, which is always really important. Of course, acknowledging the reality of Hispanic adults with the lowest rates of post-secondary care, livable income, and health insurance coverage. So a lot of work to do in the state, and all of those are forms of violence, like was pointed out by Ms. Joyce in an earlier slide. Here's the breakdown of those percentages specifically as they show up in the state's distance to goal measures. So like I mentioned before, Blacks at the bottom of the ladder at 18%. And so it starts to open up the question as to why, and that was a good chance to work with Derek and the team over there to get a better idea of what's going on at a county level. So I think this image in itself speaks a lot to the need for additional data because of how many counties in Alabama have insufficient data to even be looking at age-adjusted homicide deaths by county, specifically between 2011 and 2020. A lot of opportunity there, but Selma is located in Dallas County, and that's what we're focusing on at the moment. And as you can see, it is the dark blue, which is the highest rate per 100,000 of homicides, which is problematic. Looking at that in comparison to median household incomes, Dallas County is also dark blue in the lowest area of median household incomes. So we're starting to see a correlation there, especially with regards to what Ms. Joyce has said earlier about the likelihood of violence showing up in areas where there is poverty as a potential indicator for what's going on. To further illustrate that, there's this great scatter plot that illustrates it with even more severity of the increasing, the lower you get in median household income, the immediate spike that you see in the number of homicides per 100,000 people. So really disturbing features, and also, like I said before, drives home the point that poverty can be a pretty consistent indicator when looking at where there may be forms of violence. Of course, there are other indicators as well, and that also includes education points and a lot of other areas, which I was talking with the data team about, and opened up the conversation to where there's a lot of additional data needs that we would benefit from, and hopefully work with HOPE and other places to be able to acquire from. Specifically, that sub-county data. Now, here's an example of two cities that are located about 12 miles apart. Valley Grande was created in 2013. That was 3 years after the first Black mayor of Selma was elected into office. So the first Black mayor in the history of Selma was elected in the year 2000. And then 3 years later, there was this incorporation of a city 12 miles away called Valley Grande. There was immense amounts of white flight out of Selma. So a huge population of white folks decided to relocate out to Valley Grande, which has a variety of cascading impacts, but especially looking at the economic impact that's associated with that due to a loss of the tax base, loss of property income, as well as sales income, all those other kinds of things that would normally be going into the community, which directly or indirectly increased rates of poverty. In addition to that, there were already a series of segregated white, basically white-only academies, or white academies, let's call it what it is, that were created in response to the tracking movement that took place in Alabama. If you know more about that, be happy to share information if you're interested. But those in already existence saw an increase in attendance in those segregated academies, which then reduced the overall population in the public school system. And as we all know, public school is funded by attendance numbers. And so that saw a decrease in public funding and a decrease in what could be arguably quality education or access to quality education. So all of those are contributing factors that can lead to violence. Looking at Valley Grande, though, this is information from a website called Area Vibes that we're going to go through really quick. So again, I'd love to have data that is easily citable. I went through the site. I couldn't really find exactly where they were citing this data. Before I get to that, though, looking at the populations, I don't know if you noticed, but they're essentially mirrored from each other. Valley Grande has about an 80% population of white folks and about a 20% population of Black folks. Selma has an 83% population of Black folks and a 14.6% population of white folks. So what does that look like, and what does that mean with regards to the data? So according to Area Vibes, we can see these contrasting and mirrored images of crime rates also. So in Valley Grande, it's located at 45% lower than the national average violent crime rate, and Selma is 60% above. And these are cities that are only 12 miles away. So in the opportunity to be able to look deeper into the data sets and get a clear idea of some of the various metrics that are including this, as well as to get a very clear idea of that segregated housing and potential redlining that's going on in our area as well, would be incredibly beneficial. Also, a question that came up in the conversation when we're looking at data was, how do you quantify the prevention of retaliation? Because you can quantify murders, you can quantify violence, you can quantify violent crimes, but how do you quantify the impact of prevention and for retaliation that could come from a violent incident? So that's one of the things that we're interested in discussing, looking at, exploring, so that we can make sure that we're collecting the best metrics possible to support the program and show the outcomes that we're working towards. Really quick, just some of the current work that the Violence Intervention Program is doing. The main areas are broken into these three sectors, right? There's the street outreach team, and those are folks that are working on the ground in communities, responding to acts of violence, and also engaging with people in the neighborhood to understand what could be perceived as an oncoming violent situation, to be able to intercede and offer solutions and nonviolent alternatives to the option. Then there's victim services, which all of these respond within 24 hours. Right now, they're currently working with assistance with funerals, which has been a primary request from the community in assisting with making sure that their loved ones can have the proper services taken care of, as well as making sure that they have a connection to services and resources like counseling and other kinds of support, wraparound holistic care. And then thirdly, what is really exciting also is the partnership with the district courts and the school systems to be able to support youth in a process that's rooted in nonviolence to address crises that they're dealing with through those restorative justice circles that were mentioned in the video. Just as far as we're talking about data, before the pandemic, the organization was doing some restorative justice work in local high school, and they saw a dramatic, like 90% decrease in school referrals and court referrals from that school after working and doing the restorative justice programs. Of course, the pandemic happened to increase the separation and kind of mess with those realities, but it's proven based on the data that we've collected here locally that that approach makes a world of difference, especially in the lives of young folks and kids. So that brings us to the end of the presentation. Thank you for the opportunity for partnership. Look forward to working with you. And if you have any questions or want to reach out for partnership in any way, we are always very interested in learning more about your work and ways that we can work together to prevent violence. Thank you.
Excellent timing, Drew. Thank you so much. Pretty dire statistics, especially when you compare the two communities that live practically not even 15 miles from each other. Lots of work to do, as you said. So now I'd like to open it up to questions, reactions.
I got something. Great presentation. Drew, I'm sorry Antoine had to hop off, but as you think about getting that disaggregated data, have you all thought about, in his case, he was trying to really displace the FBI statistics as the only metric of how people experience and navigate their safety. Have you all thought about querying from people themselves what makes them safe, what makes them unsafe, police or not, community or not, but really getting at the granular level and perhaps even not so much challenging just to challenge, but to have an alternative lens and approach to what safety means from the people most closest to those experiences. Have you all spent any time thinking about that?
Yeah, so I love that question. The center, and it's great that you mentioned, the center is working right now on developing a community education process around not only the program, but also to engage in conversations and listening sessions within the community to be able to understand what's going on. A lot of the realities are, even in the meetings that we hold and offer to the community that are in person to try to create those connections, are sometimes difficult to populate because people are so afraid to participate, both coming out of their houses. I think there was an elder that said that they can't wait to be able to just sit on their porch again in the community because, people with elders sleeping on the floors because of the deaths that have happened by drive-by shootings and stray bullets that have gone into elders' houses while they were sleeping. So there's a lot of variables there to be able to collect that data. I think a very robust community engagement campaign to be able to hear and listen to what's been going on and also collect those stories, I think is going to be really important as we're approaching both elected officials and policymakers, but also in working with law enforcement agencies to not be going off of data that's not necessarily representative of the community or the actual needs of the community. Also important to acknowledge that in the ways that we work with police department and law enforcement is we only accept information from them. We don't share information back with them to be able to make sure that there's a one-way street of information coming, ensuring that trust within the community as well, because of the distrust of police departments and law enforcement, unfortunately, which we have to work around. I don't know if there's anything in addition that Joyce or Ainka want to add to that with the planning of those community engagement opportunities.
Well, I'll just add this one thing is that our law design team that was first within the Kellogg's Truth, Racial Healing and Transformation process with our district judge, who is the co-chair of that, we're going to be working with her on a Reimagining Justice campaign, because this issue of safety so often, as we saw in our last election, is very much so, particularly with our elders, so often viewed as one type of thing, right? More policing, and that's all often counterintuitive and makes us less safe, right? And so very much so having to have sort of this campaign, even to make sure that this program, our violence intervention program, is safe, for us to reimagine justice, reimagine safety, for us to remember when I heard somebody did a poem. I heard a poem when, to turn it back over to the grandmothers, right? When our grandmothers helped to keep our community safe. Like, what does that look? We're not discussing it here, but we're working on a beloved community block club initiative as well. That part of that is about, that neighborhood taking responsibility and ownership for it. And so several ways we are working trying to make sure the community is heard, and reimagining, re-envisioning what safety looks like.
Thank you, Ainka. I see that Sandra has her hand up. Sandra, any questions for Joyce, Ainka, or Drew?
I do have a question. So I was very intrigued when I heard you describe your work in terms of root cause. And it's very impressive. But the question that also came to my mind is, I understand the issue about safety, but have you dug into a little bit about why there's so much violence? Because it came to mind that there's some kind of intersectionality between the violence and something else, maybe economic opportunity. I'm making that up because I don't know. But you had such impressive data. What do you think is driving all of the violence in that community?
So if I can just say that it is one of the reasons why in the video we say that broken relationships have led to broken economies, leading to broken communities, because very much so. For example, our Economic Development Authority keeps wages low on purpose, right? They keep industry out. And if industry comes in, they ensure that wages are kept low. They call it backfilling, so people won't get their good workers, right? And so Southern Poverty Law Center employees said that hate groups study Selma to see how a small minority of white people can control a majority of Black people, because our country is becoming more and more brown, and people are trying to see how to maintain control. So it's very much so still rooted into sort of these broken relationships and a broken economy, that is we have internalized all these forms of violence, and then we display them, right? So we definitely have a framework that this isn't just about that the racism and economic oppression is deeply rooted into why this is why the physical violence is happening. And one of the challenges we have is often in social justice realms, people don't feel like physical violence is a social justice issue. And I think it's an improper analysis. And so I was very glad when I first looked at the HOPE data that low homicide rates were looked at, because we absolutely feel it's connected to a history of various forms of violence in this country that we've now internalized.
You know, I've said this probably in years past, and I don't expect a response this morning, but it always occurs to me that, you know, we're all experiencing similar problems. And I wonder if at some point the National Collaborative could just facilitate some time where we all get really immersed in some data and offer some additional suggestions and maybe some opportunities to support communities to move some issues forward. Because some of these things could be, I'm thinking of how we drive some of this work to scale, you know, from a policy level. That's just a thought, and I don't expect a response, but, you know, maybe that'll make somebody come up with something that, you know, we could use to drive some change faster.
And just on that point of scale, I think one of the cool things or the goals of this project with regards to the violence intervention program is working to create a model essentially that can be rolled out throughout the country based in this idea of building a beloved, healthy community and addressing the economic, the individual, redefining some of the narratives that are going on in people's minds about supremacy, as well as figuring out towards healing, both externally within a community through restorative justice circles, but internally on a spirit level, because, you know, principle number 5 of nonviolence is to avoid internal violence of the spirit as well as external physical violence. And when you live in a community that is so marred with social issues and you're a young person, you know, when I talk to the young folks here, there's a very real difficulty for them to see outside of this to something bigger and better. So one of the initiatives the center is working on is a Free to Dream program, which focuses on creating space through providing necessary support systems so that people can start to envision something outside of this violence, of all of these impacting various forms that are coming onto them and making it really impossible to imagine a better future.
Thank you, Drew. Thank you, Joyce. And thank you, Ainka, and all of you for your questions. In the interest of time, we're going to move now to our group conversation. We are not going to break into groups today, just to give you more of a chance to just have a conversation within the entire group. So if you can put up the slide. The questions we have now in this segment is, how does the data issues that surface in the presentations inform your work? And discuss other ways you might use data to drive and support your local action. So think about that for a little bit and raise your hand or unmute yourself.
Could you put the questions maybe in the chat? That would be awesome.
Yeah, I'm going to do that right now.
Yes.
You're amazing.
While you think of what you're going to share or ask, she will be putting up those questions in the chat.
Luz, I just wanted to throw out a thought as people are doing that. You know, the genesis for this effort was about driving a more equitable recovery. And I was struck by the correlations between poverty and violence and the vast disparities in location in terms of the legacy of redlining in Connecticut. And thinking of Sandy's comments about, you know, coming together towards scale. I just wondered about how the pandemic exacerbated the economic divides and the poverty and therefore increased the violence. So I just wanted to throw that out as something to consider in terms of making the case for, if we're going to have an equitable recovery, recognizing the core of economic barriers as both vulnerability to premature death from COVID and vulnerability to violence. So I just wanted to throw that out into the conversation too.
And Dr. Christopher, literally all over the country during the pandemic, violence went up drastically.
Yep.
Drastically, violence went up all over the country. And in Selma, our murders went up last year from when we were the 8th most dangerous per capita in the country. Ours went up by over 56%. From when we were the 8th most the worst, right? So ours drastically went up as well, even more so than all over the country. I believe the statistics were somewhere around went up 30 to 40% all over the country. And so definitely as there was a correlation of as poverty increased during the pandemic, so did violence, and then the lack of mental health resources, the lack of people being able to having tools to cope with conflict, and having to stay at home oftentimes in abusive situations. So as many reasons that go along with that, but poverty being a crucial factor in that.
Thank you, Ainka. So the questions are: discuss how the data issues that surface in the presentations can inform your work, or discuss other ways you might use data to drive and support your local action. And of course, Gail's on point with the conversation on how did the pandemic exacerbate and increase the vulnerability to violence. So take any one of those that you would like to have a conversation about, raise your hand or unmute and chime in.
I'll go because it's just so fresh. And me, stories. So literally this week, the symbol of poverty and inequity in our city in Baltimore was brought out when a squeegee boy, I don't know if you know what those are, that that do the windows at the traffic lights, was assaulted by a white male engineer who went to my high school apparently, with a baseball bat, and then was shot and killed by said squeegee boys. And so it has brought real attention to this tale of two cities in our town, right? And so is the question really about racism, a public health issue? Not quite. Is it about this issue of who they represent as impoverished folks trying to figure out a way to hustle, who have been further harmed during the pandemic? We haven't really framed that issue, but that's really what's at the core of it, and them being seen as a problem and an impediment to downtown business interests, right? And so and the efforts that heretofore have treated them as subjects and not as participants in their solutions. And we've tried some things and have been met with some frustrations, but with institutional players who want to leverage their stories for their board or for further funding, but not really partner with them. And so I think what I've heard from some of these presentations is, the more granular we get, the more we pair narrative and story and how that impacts culture and culture change, and the things that are talked about but not usually in the public square, then we can better frame and have the data also help tell a story and shift narratives. But I wanted to lift that because it's just so stark that these people who are seen as nuisances, right, and a problem to solve, versus human beings trying to hustle and survive, on the street post-pandemic, was so prominently put into center stage just this week.
Mm-hmm. Thank you, Michael. Well said. Claudia, you added a comment to the chat. Do you want to expand on
that? Since in California, the homelessness rates have gone extremely high during the pandemic. So it's really revealing the disparities of economic gaps, especially among white and other people of color. So, and that, of course, leads to a lot of what was said in the presentation today, that when you have those disparities, it's going to create these incubators of spaces, communities where there's more violence, there's more poverty, there's more health disparities, lack of education. And so just reflecting on that and how it definitely, you could see it just walking down the streets in many of the major cities in California.
Thank you, Claudia. Anyone want to add? Ask questions?
I think just following up on that, I'm from California originally, and the work out there with groups like Food Not Bombs, for example, working with individuals to provide food access and then also shelter solutions if possible, or at least advocacy for shelter issues, and their statements, which have been going on for a long time, not only the housing crisis, but additionally the food crisis, and then the correlation between access to clean, healthy food and access to shelter, and how that will be continuously exacerbated by wealth gaps and also segregation on a location-based level, because oftentimes with people that are unhoused, they are placed on the outskirts or the borders of the city for whatever encampments that are created for them by the city government, which often have limited access to public transportation and healthy vegetable stores where they can source foods, even if they have EBT or access to those kinds of things. So health disparities, just all of that, it's just so tightly woven together. It's terrible.
I just wanted people's attention to a program that aired this last weekend on Latino USA, Maria Hinojosa, and she took a deep dive into the housing crisis in California and its direct impact on the immigrant community. And she followed, some specific families, and it's something we ought to link to, in our resources for this group. It was a powerful use of media to unpack that narrative, and she talked about how even though they were emergency rent coverage and all of that, the barriers to accessing those resources were so high, particularly for those who were undocumented, as immigrants and day workers, et cetera. Really instructive and enlightening about how we don't have systems in place to meet the needs. And of course, in areas where the tech industry is dominating the economy, like, parts of California and now parts of Texas and other parts of the country, the gap between of the very rich and the very poor just drive up the cost of housing, and it makes it impossible for people to find affordable places to live. So all of gaps together as the challenges that are part of an equitable recovery, or even an opportunity for equitable recoveries.
Right. I just thank you for saying that in such a clear way, Dr. Christopher. We've been dealing with that in San Francisco since the tech boom, where there's, but it's just exacerbated even more. To cross one of the bridges here, it's like $9, and most people are living outside the city, having to commute in to pay $9 to get into the city, to get to their jobs that pay not very much. So it's really incredible. I usually compare it to what people say is third world economics. That's how it feels in San Francisco in terms of the gap of wealth of those who have and don't have. Middle class disappears pretty quickly in the city of San Francisco. And then the impacts for especially those that are really marginalized and living in the shadows, such as undocumented folks and people without papers and shared housing. Many times they're whole households living in one room in an apartment and getting charged like $2,000 for that room, not the apartment, just the room. So it's really, and that was pre-pandemic. So now post-pandemic, you can only imagine how that might have been impacted too.
I also think that I'm a special advisor for the American Bar Association's Commission on Homelessness and Poverty, and we were in LA in April, dealing with issues surrounding this. And one of the things that was just really, really clear to me, that I think the TRHT framework could be so helpful with dealing with these sorts of issues, because one thing that kept coming up as we kept speaking with those who were unhoused or formerly unhoused was that that community mattered, right? And so it wasn't just about finding a house, right? But if you were to move me, but my community is there. But when you go to someone's community and just because they don't have a brick and mortar home, you don't value the community, and their friends or their family or their chosen community, even if it's chosen by force, right, are still there, they still go back to their community because they still need that support system. And it kept happening over and over again. And so that the TRHT framework, I think, is so important as we analyze and build and work around these things, because it helps us to think and act differently than we otherwise would.
Mm-hmm. Thank you for that, Ainka. Thank you. Any other insights, questions, comments?
Yes, I like to add that the healing component of the THRT strategy is so vitally important right now. I believe that it's going to become increasingly important to deal with the lack of hope that communities have. That when you have a community of people that don't have lost their desire to help themselves and help their community. And who have, I just want to add this, who just know the motivation has just, we just lack motivation in our community. And if we can determine by way of, and I keep speaking about healing because I think that's part of the issue, brokenness. If we can determine how to get people excited about making some changes in our community, excited about and feeling ownership about their community, and that's going to pay dividends, especially now and especially in the future. I really believe it's going to be so vitally important.
Thank you, Joyce. Any other questions? We have about a couple of more minutes for this segment.
I don't have any questions, but Karen was thinking the same thing I was thinking. Thank you all for sharing of what's happening in California. Connecticut, much smaller state, but we experience similar things. Connecticut, we call it 2 states in one, where we have individuals who are living, and Karen showed you the map. We have individuals, especially in our urban areas, who feel the issues that are happening within our communities, and the data is there. And so we always talk about how COVID just highlighted the things that are happening, but they have always been there. We've known that in Connecticut, there are 2 different sets of areas. One, if you go downstate, you have the wealthy and the things that are happening in there, whether it has to do with health, caring about the communities, all of the things that just have been addressed here are also happening in Connecticut. But if you come upstate, the violence is heavier. We have a lot more issues. We have a lot more homelessness and things that are happening within our community. So I think it's important as we're thinking about changes and issues throughout the world, right? So we think of some of these smaller states, we're having the same issues. So it's the same thing, it's just at a smaller capacity. And really thinking about one, yes, I agree with Joyce, who stated about the hope and the lack of hope within our communities, but also highlighting, even when we talk about the violence has erupted and has definitely doubled and tripled within Connecticut when COVID happened. But we also have to talk about mental health, right? One, what does it look like in our communities, how it affects our brown and Black communities, what happens when those who are taught not to go and receive those services. And then we also have to talk about the affordable healthcare part of it. Do we have the resources in place? Do we have systems? Do we have wraparound services to support individuals? It's not always that they are unable to or want to go to the doctor, but it's also, do we have things in place to help them get there? So just wanted to highlight a few of the things that are happening in Connecticut that's definitely the same that are happening in your other communities.
I'd like to piggyback on to Aisha's comment. And one of the things that I have found, at least in my consulting practice, is a lot of burnout in Black leadership. And one of the initiatives that I'm working on right now has to do with the fact that many of the folks in leadership who are brown and Black are also saying access to culturally competent mental health professionals that look like them is, at least in our neck of the woods, difficult to find. And so it's proving to be a challenge. I think we have the rudiments of something in place, but it gets to be a really deep issue when you look at how Black professional practitioners are represented in most of the networks that are accessible are generally led by folks who are not Black and brown and who are not staffed by folks who are not Black and brown. So that's one issue. The other issue around violence, unfortunately, we had another horrific incidents of police violence against a community member in my hometown of Akron, Ohio, which has been ruled a homicide by the coroner. And it really just, you know, in my mind raised the question of like just getting to root cause, like how are, what's new and different about how we vet people to be allowed to be police officers. I mean, there's some psychological testing. And so just raising the question of, we need to go back and look again at just how we even vet these folks to allow them to be police officers and what are some of the criteria, because a number of years ago, you guys might remember that a 12-year-old was also killed by a police officer in Cleveland, Ohio. And just to hear that though he was deemed unfit to be a police officer in a smaller community, still hired as a police officer, then, you know, killed this 12-year-old, and then subsequently just within the last couple of months, hired in Pennsylvania by a police department. Like, what are the standards? And I don't know if that's something that can be tackled universally, but somebody needs to be looking at that. And I would be willing to be a part of a group to look at some of these issues.
Thank you, Sandra. Thank you, everyone, for your insights and your incredible passion. And I want you to check the chat, the resource shared by Michael from Mindy Fullerlove on root shock. And Drew has also posted something on mental health, which can be done virtually. And thank you, everyone, for the resources and your comments and interactions. So we will now move to our closing and remind everyone and thank both speakers today were amazing, and their presentations have been recorded if you want to take a look at them again more closely. And the documents will be in your shared resources file or folder. For the next meeting in August, we have Partnership for the Public Good from Buffalo, New York, and we have Latinx Spatial Equity from Oakland, California. Some of you are wondering about the final reports and the contract extension. I think you all have received a note about the contract extension. And I want to just show you a little bit on a template of suggestions on how to do your report that Bethlehem will pull up now. See if I can read it. Let's give her a minute until she pulls it up.
I'm sharing my screen. Are you able to see, Luz?
No, this is
currently sees the run a show. Yeah.
Oh, sorry. Okay. Are you able to see it now?
Yes, thank you so much. So this is a template of really suggested reporting guidelines, and you will be receiving this in the mail from Bethlehem. So these are 7 questions that can guide you. You don't necessarily, you can add anything you want, but at least give us some information on these 7 points. So describe your organizational purpose related to advancing policy change. including any COVID equitable recovery responses. The second one is, which policy area or areas did you decide to work with using the Hope Opportunity database? 3, what are your projected outcomes for the work you focused on for this project? Please specify outcomes for any specific population groups. 4th is, what Hope domains and indicators were helpful and why? What additional domains or indicators can be added that would be helpful and why? As you know, we are going to be updating the Hope database with your input. And please describe how you will adapt the distance to goal concept in your local work. I know that's a work in progress. And also, if you can please provide your feedback on your experience with the project, including suggestions we might use to expand and advance this work. We heard some today during the conversation, and we very much appreciate your input, but you can also include that in your report. We are going to have a meeting mid-September. As you know, your final reports are due end of September. And I encourage you to share your reports with each other, either through the shared resources or whichever way you prefer. You can use the roster to locate people. In mid-September, we would like to have a meeting just to have an overview of what we've learned, where we're going, the role VCU, Derek and Emily will be playing in putting together a final report. We'll be talking a little bit about the website that we are putting together for Leveraging Hope, which we want to make accessible on our website as well. So that's what's coming up for August and September. And I want to turn it over to Gail if you want to make any other comments, and absolutely thank each and every one of you for your participation. I think this is one of the meetings where we have had the most attendance. And Bethlehem has just put in the chat a doodle poll for that mid-September meeting, which will be only an hour. We know we have extended it to an hour and a half lately just to accommodate the presentation, so you have enough time for conversations. Anything you want to add, Gail?
I just want to say thank you, Luz, Bethlehem, and the whole team, and thank all of you for your work. You know, this is an ongoing journey. We've all been on it for decades, and we're just finding ways to come together to accelerate and lift up the possibility for meaningful and lasting change. I'm looking forward to the September convening for us, where we can sort of look backwards at the points of intersection, the things that we have in common, the strategies that could be used, you know, and replicated across our different jurisdictions. But you all are wonderful. We really appreciate you coming in this virtual community. And we've got plans at the National Collaborative for continuing to expand our community work. We'll be inviting many of you to participate in a convening in September that is driven by our Healing Through Policy work, where we curated a lot of what's going on around the country. And we're focusing in on the jurisdictions that declared racism to be a public health crisis. And so we're going to be sending out invitations, inviting some of you, those of you that want to attend 3 days and get support for that work in terms of local jurisdictions as well. So we continue to find creative ways to be supportive, understanding that it is the authentic work and voice of communities on the ground, as it began with us years ago, I guess decades ago now, in terms of Place Matters. And then collaboratives for health equity. So we just want to figure out a way to, there's an African proverb that says to stumble is not to fall, but to move forward faster. And so we want to figure out a way to move forward faster in light of these inequities that were revealed during this COVID pandemic, and see if we can't use that to accelerate some of the progress that we know has to be made. So thank you all so much. And I would just say to be continued. We'll be in touch again soon.
Thank you, Gail. Thank you to the presenters, and it's been a pleasure being in community with you this afternoon. Take care.
Bye-bye.
Happy birthday, Dr. Christopher. I
Happy
want to say
birthday.
it out loud.
Thank you. Thank you. It
Happy
is.
birthday.
Happy birthday.
Happy birthday.
Happy birthday.
Happy birthday.
Happy birthday to you.
Happy
And
birthday.
Happy birthday to you.
I was gonna mention you received a lot of love in the chat as well,
oh,
Gals.
thank you all. Well, let's save those chats so I can look at them. But no, it is a happy birthday. To be with all of you makes it perfect. So thank you. Bye-bye.
Bye, everyone.
Thank you.